Welcome everyone. We're so excited to have you here tonight for our 4th annual Fellows Fest event. Tonight obviously looks a little bit different than it has in the past, and we regret that we couldn't do this together with you in person. But thanks for joining us virtually, and we hope you have a great evening. Before we get started with our fellows, I would love to share a little bit about our fellowship. Tonight, you're going to hear from members of the 2020 Alabama Schweitzer Fellowship class about how you can be a part of their work. They need you, in fact, in order to help them have the supplies, the volunteer manpower, and the participants. I also know that by the end of tonight, you will learn something about a topic that you may not already be familiar with. So enjoy being inspired and called to action by these great fellows. Before we get started, let me share a little bit more about the Schweitzer Fellowship in case you're not familiar. So our vision is to create a global core of leaders who promote positive change with and in our communities, our health and human service systems, and our world. If you're watching tonight from the state of Alabama, then chances are you live in a county that has a shortage of primary care, mental health, and/or dental providers, possibly due to geography, but also likely due to a gap for low-income people. The images that you see here on the far left represent the mental health professional shortage area, then primary care, and then dental. Specifically, I know it's hard to see, but the low-income shortage is represented in blue on the far left map, in blue on the middle map, and in pink on the far right. So what this means is that our healthcare system needs practitioners who are not just skilled in their specific profession, but who also have skills and a commitment to serve the needs of the most vulnerable in our state. The COVID pandemic has shown us what can happen if we neglect addressing health inequities. Fortunately, there is a solution. The Schweitzer Fellowship guides ambitious students who sense a calling towards a career working with underserved populations and asks them to do 3 things. First, we ask them to serve 200 hours with a community partner, to attend trainings to learn from leaders in health and human services, and to spend time reflecting by themselves and also with their peers. What results are investments in both the community and the individual students. In fact, by the end of each year, the Alabama Schweitzer Fellows have contributed between 2,400 and 3,000 hours of service collectively. More important, they did so at the level of a highly skilled volunteer who essentially piloted a project in collaboration for a local organization. What this means is that a large number, about 70 to 80%, are sustained in some way. We also find increases in knowledge and commitment by our fellows after completing their year of service. To see more about these results, we encourage you to check out our website where we have profiles of all the fellows since 2016. But don't do that now. Stay tuned because we are about to kick off what you came here tonight to see. We'll start with 2 of our fellows, Harley Moore and Hadia Page. One second.
A graduate student studying public health at the I am Hadia Page, a graduate student studying public health at the University of Alabama at Birmingham. Children need a creative outlet and safe space where they can learn how to identify and express their feelings. I believe that art and other creative activities can be a fun way to develop these skills. As a Birmingham native, my Albert Schweitzer project is dedicated to helping youth affected by gun violence and incarceration gain skills essential to self-efficacy and management through structured social and emotional learning. Today, you can be a part of this transformative experience for our future leaders by donating.
War Eagle, I'm Harley Moore, a doctor of pharmacy candidate at Auburn University, working towards increasing access to food on Auburn's campus. Over 8,000 students on Auburn's campus reports being food insecure. Food insecurity has proven ties to poor academic and long-term health outcomes. Join the Auburn family today by donating to the AU Campus Food Pantry to make sure that no Auburn Tiger goes without enough healthy food.
All right, thanks to Harley and Hadia for kicking us off. We're actually going to be joined by each of them now. Let's get them in here so that we can ask them some questions that you submitted. Hey, Harley.
Hey.
Thanks so much. Hadia, are you here with us too? All right, well, while Hadia gets connected all the way, Harley, I'll kick it off with a question for you. So earlier this week, some people raised the question about college students, and they expressed kind of being a little bit surprised about college students being in need. Can you tell us a little bit more about what are the challenges that make college students vulnerable to food insecurity?
Yeah, of course. So I think most notably, it's important to kind of recognize that over the years, whether you're attending a 2-year university or 4-year university, cost has significantly increased. So we see that students are kind of having to choose which basic needs they want to cover. Do you want to make sure that you have safe housing and money for your food and books? And then maybe you can make your food money stretch a little bit further. I also believe it's kind of negligent not to comment on kind of the infrastructure that prevents college students from really getting help. Sometimes the SNAP program has very stringent rules and regulations for college students, so that kind of limits some students from being able to get that help. Community resources sometimes require students to show financial need. Well, a lot of college students are still filed under their parents' taxes, and so they may not necessarily on paper have need, and so that also limits that resource. And then also there's just kind of the stigma of people not really talking about the resources on campus that are available to students because of food insecurity does have a big stigma around it. And so just kind of a compound of all these factors, and I'm sure individual students have their own individual challenges too, really hurt students and cause food insecurity on college campuses.
Hadia, are you here with us now? All right, well, another question. Oh, there she is. Well, let's get a question to you, Hadia.
Okay, great.
Tell us a little bit, what made you decide to use art as a medium for reaching these kids?
Well, we can see a lot of times, especially within inner city schools, most of the focus is placed on expression via sports or some other form of maybe sometimes music or choir or something like that. So I felt that approaching it with a structured social and emotional learning concept would provide students with a little bit more insight as to why they go about doing just their regular everyday activities, as to why they go about performing in sports and musical activities. All of these, like the combination of these assignments and activities really helps them develop a holistic sense of who they are as a student, and it helps them develop a holistic sense of who they are in their developmental stages. So I think that the biggest benefit with art therapy is, as opposed to all the adrenaline that is usually associated with sports, they kind of have to go a little bit deeper inside themselves and practice a little bit more mindfulness. And that just gives them a different paradigm and a different way of thinking.
Absolutely. So Harley and Hadia, we watched y'all's videos first because y'all had something in common, and that was the fact that you need some funds to kind of make your projects be the most successful that they can be. Can y'all just real briefly share with the audience what it is that you're trying to purchase and how they can go and get those items for you? Harley, you want to go first?
Yes, I will. So the Auburn University Food Pantry is completely funded on donations. And so one of the things that I am really looking forward is either purchasing individual items. So we share the Amazon link, and you can go on our Amazon link and purchase items for our students. Or you can donate on the Amazon page. There's also where you can donate a monetary donation, and then we can go in and purchase items. So we're just really asking that you help support us and the students on Auburn's campus.
Well, for me, we actually do have an Amazon link also set up via the ASF website. So we are just looking to purchase a little bit more supplies, well, a lot more supplies for the children. We understand that they do need a variety of different activities in order to stimulate, different parts of their minds and different parts of their creativity. So the more access that we have to different mediums, then the more beneficial that this program will be. So we are looking for participation from our community, and is greatly appreciated for everyone that is seeking to be a part of this.
Great. Well, thank you all both for being here tonight. We'll make sure that we continue to share the links to both of your sign-up lists so that people can help, because I'm sure they're going to want to just reach out and see how they can be involved. So thank you all for joining us.
Thank you so much, Christine.
Bye, all.
All right, well, let's take a listen now to some more of our fellows who are seeking your involvement as well.
Hi, I'm John Paul Osula, a second-year medical student who's working to reduce educational inequalities for students interested in healthcare in the Birmingham City School District. Many of the Birmingham City schools are in low-income communities that also have low social capital, but the lack of mentoring and resources leads to these schools having some of the lowest graduation rates in the state. I plan to combat this problem through healthcare career exposure and mentoring that will motivate students to set and achieve long-term goals. I believe the best way to reach these students is through exposure to real people working in the healthcare field. I'm asking for those who work in the healthcare field to assist me by volunteering your time to teach students about your career to inspire future healthcare professionals.
Hey y'all, my name is Lita Wagner, and I'm in my final year of law school at the University of Alabama School of Law. Not far from my university is a rural area where many Alabamians live in poverty and cannot access legal services. Individuals who show up at health clinics for their medical needs often have underlying legal needs as well. My Schweitzer Fellowship Project will allow low-income patients at a rural health clinic to video conference for free with lawyers from Legal Services Alabama. With your help, we will improve quality of life for rural Alabamians by expanding access to the legal system. Please contact me if you're interested in volunteering to assist with intake paperwork.
All right, so let's move into our next Q&A. We have Lita Wagner, a student from the UA School of Law that you just heard, who is going to be joining us. We'll get her in here now. Hey, Lita.
Hey, Kristen.
Thanks so much for joining us tonight.
Happy to be here.
So you mentioned wanting to support clients who had some legal needs. Can you tell us a little bit more about what are the types of problems that you anticipate they may have?
Yeah, so I think a lot of the problems will likely be financial in nature of some sort. So if someone needs help filing for bankruptcy, we could help with things like that. Also, one thing that's an issue for a lot of people is having their bank accounts or their wages garnished. And so there are some exemptions where there's a certain types of property that you can retain even if you're being garnished. So we could help with those types of things to help people have keep some of their precious belongings and some of that money. Also, one thing that is a huge factor that affects health outcomes is housing quality. So if there's any issues with foreclosure or eviction, we could help with those. Public benefit denials, we can help with that, food stamps and disability benefits. And then if there's any domestic violence, we can help with protection orders and also divorces when there's domestic violence.
So it's clear that you are not only getting a lot of hands-on experience, but it sounds like you've got a mechanism for other law students or even not law students, right, to get involved. Can you tell me a little bit more about that?
Yeah, so we're looking for student volunteers, and they don't have to be law students. Law students might have a little bit more experience with some of the issues, but we're looking for volunteers to help with the intake paperwork. So basically screening patients for financial eligibility, and also just talking to them and trying to figure out exactly what the problem is and recording that. So then that way it saves the attorney some time to be able to just get it, here's what I think the issue is, and then you hand over the information to the attorney to resolve that client's issue.
So remind those listening, if they do want to be involved with your project, what should they do to follow up with you?
Yeah, so if you would like, you can email me at lita@wagoner.com. If you can spell my name, then you can email me, and I'm happy to get you all involved and really help a lot of people.
Great. We'll make sure to share your email address too with everyone. Let's see how we're doing on time here. Do we have time for one more question? I think we do. Great. So what advice would you have? I know we have some people joining tonight that might be thinking about applying for this next year. So sorry if this is a little off topic, but can you speak to any of those prospective students? Just what advice would you give them as they think about, you know, how to pick a project and how to just even begin to think about the fellowship?
Yeah, I think that one thing that I would say is take some time really trying to figure out what kind of issues are going on in your community, because I know we spent a lot of time at the beginning of this year in my Schweitzer fellowship year trying to work on a needs assessment and try to see what kind of needs there were instead of just assuming that that something's a problem. So I think I'd really do that, and also just leverage your network, talk to people, try to figure out what's going on, what organizations need help with. And sometimes that's a more natural way to go about it. Instead of saying I got to figure out a project to do, you just go to people and say, what do you need? How could I help with that? And try to find something that aligns with your interests.
I think that's a great point you make too about existing relationships. If you've already been involved with a volunteer agent, you know, with an organization as a volunteer, an intern or something, then you've already gotten to know the people a little bit, and that probably helps in some of those, you know, first steps, I guess. Mm-hmm. Well, thank you so much for being with us tonight.
Thank you.
All right, bye.
Bye.
All right, so I know we've got people kind of popping in and out tonight, so I wanted to just remind everyone sort of what the fellowship was about and what we ask our fellows to do. So each year we select about 12 to 16 graduate students from universities around the state, and we give them this challenge. We ask them to identify an unmet need in the community, like Lita just alluded to that she had done earlier this year. And we ask them to find a partner and to figure out how they can spend those 200 hours to make a difference. Likewise, tonight is kind of a challenge to you as the viewers to figure out now how can you come alongside them and help them achieve their goals. So with that, we've heard from fellows who are looking for supplies to make their projects a success, as well as from others who need volunteers. Now we're going to hear from another group who are going to tell you about how you can help spread the word about their projects so that they have the participants that they need. So bear with me here and I'll get us watching their videos.
Para cepillarse los dientes, coloque su cepillo de diente en un ángulo de 45 grados. Was that confusing? Are you a bit frustrated or ashamed that you didn't understand what I said? My name is Anna Ospina. I'm a third-year dental student at UAB. Communicating with our patients is a crucial part in providing successful care. From consent to at-home care instructions, it is essential that we have meaningful conversation throughout treatment. Our Spanish-speaking population is a significant portion of our population and steadily increasing. When a patient comes to us with limited English proficiency, it is our responsibility as healthcare professionals to make sure that the level of care they receive is the same as our native English speakers. I'm introducing dental Spanish into the dental school curriculum so that students and graduates can better serve their Spanish-speaking population.
Hi everyone, my name is Monty Kamal and I'm in my final year of medical school at UAB School of Medicine and I'm working to achieve health equity. Through partnering with Alabama Regional Medical Services, my Schweitzer Fellowship project aims to increase the rates of HPV vaccination, a vaccine that can help prevent cervical cancer in underserved communities in my state. Alabama is tied for the state with the most cervical cancer deaths in the country. This devastating disease can be prevented with a 30-second intervention, a quick vaccine. That means more vaccines equals less cancer. So please support this initiative by encouraging friends and family to get the vaccine. It can save lives. And in fact, in the time it took me to tell you about my project, you or your loved ones could have already received the vaccine, prevented a lifetime of invasive cervical cancer treatment. Thank you.
Hello, my name is Maiwa Flada. I'm a doctor of nursing practice student at the UAB School of Nursing. Do you know one in several mothers experience postpartum depression after birth? For my Schweitzer Fellowship project, I'm working on improving postpartum depression among first-time pregnant and postpartum clients by creating an online postpartum depression support group, which partners with the Nurse Family Partnership of Central Alabama. My goal is to help decrease the feelings of loneliness, hopelessness, and improve overall mental well-being by educating first-time mothers on the signs and symptoms of postpartum depression and the need to speak up. Thank you.
Hello everyone, my name is Bhumika Patel and I am a final year dental student at UAB School of Dentistry. I'm working on healthy eating by establishing a healthy eating with my PIP program for UAB grad students. Healthy eating is very important for your good health and overall well-being. Staying healthy physically can also help you stay healthy emotionally too. Our program is to provide nutrition education through various elements, including how to change your lifestyle to create a healthy eating lifestyle, and also including better understanding of nutrition element of all the food items that you purchase, and also increase understanding of food package eating, and also through various cooking demonstration. By participating in all of these activities and also cooking demonstration, you will get better understanding and broader sense of awareness when to choose best food for your every meal. And by engaging in all of these activities, you can definitely see a difference in terms of better energy level, and also focus, productivity, emotional well-being, and many more. So to take the advantage, please sign up today on the below link. Thank you so much.
Hello, my name is Emily Mudd, and I'm a current PhD student at Auburn University in the School of Kinesiology. I'm also a 2020-2021 Albert Schweitzer Fellow. I'm excited to tell you about my project working with the Girls on the Run of South Central Alabama. We are hoping to address the growing health disparity of physical inactivity for girls with and without developmental disabilities. Physical inactivity is associated with several health risks, including obesity, depression, and anxiety, as well as heart disease. Girls in the middle school age group are significantly more inactive than their male peers. Additionally, individuals with developmental disabilities face a significant amount of barriers to inclusion in physical activity. They are often also left out of after-school programs. Our group hopes to tear down these barriers and create an atmosphere of inclusion and advocacy for individuals with developmental disabilities. We hope to do this through promoting inclusion, physical activity, and self-esteem in middle school age girls through the Heart and Souls program for Girls on the Run. My team will have a fall and spring season, which will all culminate in a 5K at the end of each season. This is where we hope to celebrate each girl's hard work throughout the program. As an avid swimmer and runner, as well as a special educator, I'm so excited to share my passion for inclusive physical activity with these girls. Thank you.
Hi, I'm Katie Ellison, a doctoral student in nutrition sciences at the University of Alabama at Birmingham, where I'm working to increase the number of participants in my nutrition program called Cooking Well. We are exploring the role of nutrition education, hands-on cooking experiences, and financial discounts in improving food purchases at a local grocery store by making recipes that taste great and are cheap. Unlike other nutrition programs, we have combined all three elements into one program, which we believe will improve food purchasing behaviors, eating habits, and ultimately overall health.
All right. We are up now with two more of our students who are going to join us, Emily Munn, that you heard from Auburn University, and Mani Kamal from UAB. Let's get them in here and share some of your questions with them. Hey, Emily.
Hi.
So we just heard about your love for both sports and working with individuals with disabilities. Tell us a little bit more about your background and sort of how you've found a way to combine the two.
Yeah, absolutely. So I'm a lifelong swimmer. My mom taught me when I was 18 months old. There's an adorable little picture of me from 18 months jumping off a diving board. And I started competitively swimming at the age of 6. And besides just loving swimming, I also grew up with learning disabilities. And so swimming gave me an outlet to be self-confident that I wasn't really getting in school from the start. And then growing up in high school, I would go to swim and think about my assignments and my projects while I was there. And for some reason, while I was swimming, I had a better ability to learn and think about and create those ideas. And then I could go back home and write those assignments up. And so I just used swimming as that outlet for me. And then I went on to swim for Auburn University during my undergrad. And at the end of that, I met Dr. Pangelinan, who's my boss today. And she asked me if I would be willing to help teach swim lessons to individuals with developmental disabilities. And I was like, absolutely. So I went and did that with her, and it changed my life forever. And I went on to get my master's in special education so that I could continue working with them. And now my PhD, where I'm working on adaptive sports and adaptive physical activity. And so over the last few months, I've been working on training for a triathlon and have started to fall in love with running. And when I was looking for how to make a more inclusive atmosphere and physical activity for my girls, I found Girls on the Run, and their project was just a perfect way to take a step forward and making that team truly inclusive by recruiting girls with developmental disabilities to it.
Awesome. So Mani, we heard about your project with trying to increase HPV vaccinations. I feel like vaccinations just in general are one of those things that oftentimes have a lot of just misinformation out there. Is there anything you would want the audience to know, anything you want to clear up, I guess, about the HPV vaccination?
Yeah, no, good question. So yeah, I do think vaccinations sometimes do there is a lot of disinformation and misinformation out there. Just from being in clinic and talking to parents, I think there's kind of a few things that I hear a lot from parents that they're just concerned about. So this is like the HPV vaccination is a relatively newer vaccine compared to vaccine like the Tdap vaccine or meningococcal or some vaccines that we've had a little longer. That being said, it is safe. There are very, very few kind of adverse effects of this vaccine. And then another thing that I've heard So the HPV vaccine is recommended for both boys and girls. The HPV vaccine can help prevent cervical cancer, and so a lot of parents are like, well, boys aren't susceptible to, or they're not at risk for cervical cancer at all. But another thing can help prevent is any kind of squamous cell cancer. So any cancer like in the neck, it can help prevent warts as well. So it's kind of one of those vaccines that I think people just associate with women and associate with that specific cancer, but it really has a lot of effects for both boys and girls and men and women.
I'm learning things myself.
There you go.
Squamous cells. Who knew? So Emily, tell us about, I know you are kind of going to be recruiting participants for this as well as for the spring. So if you were, if someone was listening tonight who wanted their girl to participate, can you tell them a little bit more about like, what's something fun that they might do as a part of your program? Give them a little bit more insight into what that looks like.
Yeah, absolutely. So the reason that I think Girls on the Run is so wonderful comes from not just the physical activity piece with the running, but actually the program itself is built to help girls develop self-esteem as well as positive female friendships. And so that piece where they actually are running alongside each other rather than just running is what I think will be probably the most fun for all the girls, is getting to know their teammates and going and doing these activities. So when we're running a lap around a track, it's not about running a lap around the track, it's who you're running it with and talking to those girls and helping them develop those skills to have those peer relationships where they can talk through issues they might be having at school or might be having at home, and just giving them an outlet to be able to express themselves in a also physical activity setting. So that is a big piece. And then we also culminate everything with a 5K at the end, which sounds kind of like not fun if you're not an exerciser. But for our girls, we want to make sure that it is a blast. And so even with COVID, where we'll probably be doing that virtually, we're going to provide the girls tutus to wear, paint for their face, bracelets, and just fun supplies to make it even more fun to be running that 5K and promoting that across the year.
Yes, so I've seen a Girls on the Run, and I have to say, if I'm going to be in a 5K, that's the one I want to be a part of, because it is definitely a lot of fun. Monty, before we go, I know Emily mentioned kind of how she was having to adapt due to COVID, and that brought up another question, which is what impacts are you seeing in the clinic, and how is that affecting vaccinations right now?
Yeah, so I guess the good and bad thing about working in a medical setting is kind of they have to provide care kind of throughout this and no matter what. So I'm still able to go in person, and you can't give vaccines virtually also. So I'm there physically as well. But I think what surprised me the most is a lot of kids, especially in the summer, go like they do right before school starts, kind of, I guess, late July, early August. And I don't really have anything to compare it to because I wasn't there last year, but just from talking to the providers at the clinic, I've kind of seen that their patient volume is less than they expected, which, I mean, if you kind of think that through, it makes sense, but it just sort of trying to figure out how to best help this smaller number of patients kind of coming in versus a larger population. And it's fun to listen in because I learned something new about Emily, and she was talking about training for a triathlon. So I'm a runner, and I started training for a triathlon, I guess. It got canceled, but in January, and like was in a pool for the first time. So we'll have to exchange some tips on that.
Absolutely.
I'm definitely the oddball out here, so you can tell me about your triathlon experiences. I'll come and cheer y'all on. Well, thank you all for being here today, and it sounds like maybe the takeaway is sign up, get your girls involved, or take your sons, daughters, granddaughters, nieces, nephews to get vaccinated, and make sure they're staying on track with all of that. All right, thank y'all.
Thank you.
Thank you so much.
All right, we are going to shift now to our fourth and final group of fellows. so you can see what they are doing. They're going to share more about how you can be aware and advocate for the issues that matter to them.
Hi everyone, my name is Sheila. I'm a second year med student at School of Medicine. And in my Schweitzer fellowship, I am working with the Adult Spina Bifida Clinic in Spain Rehab here at UAB Hospital to develop a bowel management protocol for adult spina bifida patients. I think what a lot of us healthy adults often take for granted is being able to use the restroom in an efficient and timely manner whenever we need to, as a pretty quick and easy process. However, what takes us maybe 5 minutes max can take spina bifida patients a lot longer due to the amount of planning and logistics involved. So we're hoping creating a more standardized protocol will provide patients with a resource that they can refer back to at any point and at any time they need. Thank you very much.
Hi, my name is Madison Smith, and I'm a Master of Social Work student at the University of Alabama. As an Albert Schweitzer Fellow, I am working with Family Wellness Court to broaden their services to not only help those involved with family court who are also suffering from substance misuse issues, but also their families. Addiction is truly a family disease, and unfortunately, many family members of people suffering from addiction do not know how to ask for help or where to go to receive help. Addiction touches many families' lives, and sadly, many go without the support and resources to help fully recover from the devastation that it causes. This is why all I am asking for today is an increased understanding of addiction as a family disease and for the promotion of services that help both those with substance use disorder and their families, such as the services that Family Wellness Court provides. Thank you for listening to me today.
Hi, my name is Tanya Nix, and I am a DMP student with UAB School of Nursing. With over 25 years working as a registered nurse and nurse practitioner, I have witnessed the benefits of facilities transitioning from paper charting to electronic medical records. This has improved patient care, has also improved communication between providers, as well as between the providers and the patients and caregivers. As an Albert Schweitzer Fellow, I will be working with the Foundry's Mobile Clinic, which is managed by UAB School of Nursing. This clinic is a free clinic, and it services underserved communities that have patients with limited access to care due to cost or transportation issues. Working with the School of Nursing and the clinic, I will be transitioning the paper charting there to electronic medical records in hopes of improving the workflow of the clinic, reducing costs to the clinic, and improving access to care and patient outcomes for the patients. Thank you.
Hi, I'm Abigail Krause. I'm a second-year medical school student at UAB, interested in reducing maternal mortality in Alabama. Cardiomyopathy, a form of heart failure, is the leading cause of postpartum maternal mortality in the United States. Despite this, there's limited data on the postpartum needs of women with heart failure. The Happy Mom, Happy Heart Project seeks to uncover the barriers these women face and to bridge the gaps in care and support during the first year after childbirth. Ultimately, listening to mothers today will improve the lives and care of mothers tomorrow. Thank you.
Hi everyone, my name is Griffin Hall. In addition to being an Albert Schweitzer Fellow, I'm also a Master of Public Health student at UAB and a youth homeless service professional at an organization called One Roof. Recent research shows that 1 out of 10 young adults and 1 out of 30 teenagers in the U.S. experience homelessness in a given year. I'm currently working with a group of social services to understand what youth homelessness really looks like in Birmingham, how widespread it is, what some potential solutions might be, and what its causes are. We're currently working on needs assessment to hear directly from youth who are experiencing homelessness about their needs, and then hope to develop some solution to those specific needs using the resources that are available at our partner organizations. If you would like to participate in that project, or have any youth to refer to the needs assessment, or to just general youth services, please don't hesitate to visit the One Roof website or email me at career@oneroofonline.org. Thank you.
right, well, we're going to be joined now by two of the fellows, Greer McCollum, whom you just heard from, and also Kay Cole, who will be telling you more live about her project. So let's see if we can get them in here. Hey, Greer.
Hey, how's it going?
Good. Hey, Kay. So Kay, let's let you maybe get us started. People didn't get a chance to hear from you. So why don't you just start by telling us briefly what you're doing with your project?
Okay.
So tell
Hey,
us
Chris.
Hey, can you hear us okay?
I'm getting an echo, so give it just 1 minute.
And it may be if you're listening, if you have the Facebook live stream on, you may have to mute that audio. I tell you what, while you get that, I'll let you listen into Greer, maybe answer a question, and you can see if that helps. So Greer, we asked Monty kind of a similar question earlier about misconceptions that people may have about the topic that you're addressing. And I feel like youth homelessness is probably one of those issues as well, where there's a lot that people don't know. So can you just help educate us a little bit more?
Sure, I'm happy to do that. Youth homelessness is, definitely, there's a lot of misconceptions, I guess, broadly about homelessness, but maybe specifically about youth homelessness. There's actually an entire kind of sociological term for youth homelessness, and that it's also kind of called hidden homelessness a lot, because young people who are experiencing homelessness typically aren't the same people who you might see sleeping in a park or sleeping on the sidewalks. Generally, youth homelessness is a lot more hidden. So young people may be couch surfing with relatives. They may be, staying at hotels. I've even met a lot of young people who try to spend the night in hospital lobbies. So hidden homelessness, there are young people who are experiencing homelessness in those kind of unstably housed forms that can easily lead to a more kind of street or shelter form of homelessness. So it's so widespread that recent research shows that young adults in the U.S., 1 out of 10 young adults in the U.S. will experience homelessness at some point throughout a year, and then that 1 out of 30 teenagers will also experience some form of homelessness throughout the year.
So your project is definitely one that has some big ambitions, and yet, the work is going to continue beyond your Schweitzer Fellowship project. So can you tell us maybe just what your vision is for what this will look like in maybe 3 or 5 years? What's the bigger goal here?
Yeah, I would see, I don't know if you got to mention, Kristen, but I work as well full-time within kind of the youth homelessness space. So I kind of get to see on a ground level in the day in, day out what the system for youth homeless care looks like. And generally, as with other forms of homelessness, it's really just a response system. And as kind of a public health person, I would really like to see it as a preventative system. So I'd love to see ways that we could quickly identify youth who are at risk for homelessness and quickly try to get them or help them get stabilized, as opposed to just responding as soon as they first experience homelessness. So I would love to work upstream with other systems who often feed into youth homelessness, like the child welfare system or the justice system.
So Kay, let's come back to you now. Tell us a little bit about what you're doing with your Schweitzer Fellowship project, and also maybe how did you arrive at this topic? What's your connection?
Sure. My Schweitzer project is to provide online counseling services for parents and other caregivers of children with disabilities. And I arrived at that project because we have a daughter. She's 20 years old with autism, and she's nonverbal. And just the process of the diagnosis, the advocating for her, not only at school, but advocating in dental offices and medical facilities where they did not understand her ability to communicate sometimes, or her need for certain foods. There's just a process, and sometimes, she doesn't sleep. There's just something that a lot of parents go through, And I felt like another parent could really understand those challenges. And yeah, she was basically my inspiration.
So it sounds like the your target group that you're trying to reach is obviously just very busy. So what would
Yes.
you say to them if someone was listening right now or knew someone who might be a good candidate for your group? How might you encourage them to be a part?
Well, I would imagine that any parent or caregiver listening would say, I would love to do that, but I just don't have the time. And I would agree. You don't have the time. There's never any time. But I think it's very important for parents and caregivers to make that time and to connect with other parents and other people that that are looking after kids or adults with disabling conditions, because you do need kind of a group that understands you. I would say that if somebody wanted to do it, but they were not sure how to make the time, to reach out to me. We'll find a way. I would love to include anybody. We would just make a way.
Well, and that's a great segue. I was going to ask, like, if people are interested, what should they do to get involved?
They should contact me at kaye.culp, C-U-L-P, at cahabamedicalcare.com. Cahaba Medical Care is my side partner, and they have information on their Facebook page as well, or through the Schweitzer Facebook page. My contact information should be there.
Great. Well, we'll make sure and share this on our platforms as well for anyone listening. I know, I think we haven't gotten any other specific questions, but I've been hearing that there's been a lot of just positive feedback. So thank you all for what you're doing, and thank you for being here with us tonight.
Thank you.
Yeah, thanks, Kristen.
All right. So in our last minute here, I just want to share a final word. This is actually a quote from Dr. Schweitzer. I just feel like as we go, this quote can serve as a reminder that we all have a responsibility to others. It's just a matter of how we choose to live it out, both through our lives as well as supporting the efforts of others. I love this quote because I think it's an embodiment of what our Schweitzer Fellows are doing. They're certainly shouldering their responsibilities, and we're glad to be able to support them. We would love to hear more from you. We appreciate you taking the time to join us tonight. So you can continue to share your thoughts about tonight on social media using hashtag FellowsFest20. Also, I encourage you to go to our website, which is listed there. If you're not already receiving our e-newsletter, there's a form at the bottom of our website where you can sign up to receive that so that you can stay connected and hear updates about these fellows. They will be continuing their projects through April 2021, and we would love for you to hear how everything goes with the remainder of their year. With that being said, that concludes tonight. So thank you again for being with us, and we look forward to staying in touch. Good night.